This healthy living tip is brought to you by the Christ Hospital.
Pulmonary hypertension is an elevated blood pressure in the blood vessels that course through the lungs. The symptoms that pulmonary hypertension causes are mainly shortness of breath, lightheadedness, dizziness, and fatigue, sometimes chest pain. When the disease is very advanced, it causes swelling of the legs. One of the main problems with pulmonary hypertension is that it's more common than doctors originally believed, and it's commonly misdiagnosed as other more common conditions such as asthma and COPD. That's why it's so important for patients who have unexplained shortness of breath that's not responsive to therapy to seek consultation with a center that's familiar with this disorder. The only way to accurately diagnose this condition is with a procedure called cardiac catheterization, in which a small tube is threaded from a vein in the groin area to the heart. An actual measurement of the pressure inside the heart and the flows inside the heart and the resistance to flow through the lungs is made. Without this procedure, the diagnosis cannot be made with certainty. Prior to cardiac catheterization, tests including EKG, echocardiogram, pulmonary function tests, and pulmonary VQ scanning or lung scanning can lead toward the diagnosis, but catheterization is the key to the diagnosis. Now, there are 9 medications available, and many of them are very effective and life-prolonging. Christ Hospital has developed a major program in the treatment and diagnosis of pulmonary hypertension. We have expertise at all levels, including not only physicians, but the nursing level, with a dedicated nurse who is extremely familiar with this disease and its management. Also, the inpatient unit at Christ Hospital contains one nursing unit which is extremely familiar with the medications involved in the treatment of pulmonary hypertension and is able to expertly care for patients with this dangerous condition. The Christ Hospital wants to make the medical community and the community at large alert to the possibility of this dangerous condition in patients with unexplained shortness of breath.
To speak with a clinician, call 1-866-596-6118.